My name is Bosire Benson and welcome to this show. This is about health and we have a friend who is a doctor here and is called Dr. Musungu. Karibu to the program, sir.
Asante.
Last time was awesome and so we continue this time with health matters concerning lifestyle issues and the diseases that come out of that one. And what is our topic today?
So today we're going to talk about hypertension.
Hypertension.
In simple words, tension that is high. Hypertension. Blood pressure.
I know hypermarket.
There's hyper. There's what is it? Hyper. No, those are
supermarket and hyper.
There's a hypermarket. There's a supermarket.
So the hyper is above the super.
I'm not sure.
Okay.
There was a Nakumat hyper.
Yes. But so basically the name means something high.
Something high, something elevated.
Yes. Okay. So is there an opposite to that?
Yes, there's hypotension.
Hypo.
So hypotension means low.
Oh,
yeah,
so
but that's not hyper
and
then hypo. But hypotension is not as big as
an issue
in our lifestyle.
Okay.
In our lifestyle in the world.
Okay. One day maybe we'll tackle that one also.
Yes.
So today is hypertension.
Yes.
But that's not the name that people know it by.
Wanaijua kama pressure.
Pressure.
Yes.
Blood
Common
pressure.
wananchi will know it as pressure.
So, pressure.
Pressure imepanda.
Now, to the biology of that.
Yes.
What is happening to the body that you have this hypertension? And the tension part also, before we go to that one. The tension, so it's just the name, the word tension in English.
Yes.
So high tension.
High tension. Yes. So if you think about it that way, then it helps you maybe have a framework of how you'll understand it. But hypertension is one of the most common lifestyle diseases we have in the world, not only affecting Africa and sub-Saharan Africa, but also even in the West. So this is one of those illnesses that cut across the whole world. So it's significant for both rich and poor people. So it has no demographic, it does not follow that kind of demographic. Okay. And maybe to talk about how hypertension or what it is exactly. So how we look at it in the medical field and a way that you can easily understand is hypertension is when the blood pressure is above a certain set limit. Okay. That set limit being 140/90.
Okay, now.
Yes,
a bit. So there's blood in us, and that blood is in the vessels, arteries, and veins.
Yes.
So there should be a pressure with which that blood flows in those veins and arteries.
Exactly.
And this is determined by?
So this is determined by your heart and the vessels themselves. So
if you have a big heart, does that make it?
Not necessarily. So let me put it this way. So you have your heart, isn't it? And I should have said this earlier, but blood pressure is measured in the arteries.
Not the veins.
Not the veins. Veins are low pressure vessels.
So they're taking blood back to the heart. So the arteries are bringing
the ones that
so they're the ones receiving blood that is coming off the heart.
The heart, directly from the heart. So when your heart contracts, when it contracts, your heart contracts and relaxes, contracts and relaxes. Think about especially the lower chambers, if you can remember your biology.
The four
chambers there.
And then the two lower.
Exactly. So you have the two upper ones, which are called atria, or auricles. I think we had that name as well. And then the two lower ones called ventricles. Yes. So now the blood from the left ventricle is what pumps blood the left ventricle is what pumps blood all the way to the rest of your body.
So the lower part of the heart, the right side,
left side,
yes, as the left ventricle.
Yes,
that's the one that pushes blood out of the heart
to the rest of your body.
The rest of the body.
Yes.
Okay.
So as it's doing that, it generates a pressure inside the blood vessels.
So the contraction creates that pressure now that is
exactly
sent. Okay.
And that pressure has to be within certain limits. But if you think about it this way, so it's a pipe coming out from a pump. So if not only is the blood pressure going to be influenced by the pump
contraction,
but also the pipe.
The size of the pipe.
Yes. Also. So if the pipe is big, then the pressure is going to be slower. Or the velocity is going to be slower and the pressure is going to be lower. But if the pipe is too constrict for some reason, then that's going to
cause
not only
the pressure.
Yes, it will affect the pressure, but also will force the ventricle to pump harder. Yes.
Okay.
Yes.
Good. So that's the heart from the heart. So the blood is being pumped out.
Yes.
The normal one you said is 140/90.
The normal actually is less than 120 systole. So systole is during contraction of the left ventricle. That's there's systole and diastole. So let's get a bit technical.
Okay.
But they are just fancy names for systole is contraction.
When the heart is doing that,
is pumping. Yeah. So that's systole. How I used to remember that is systole reminds me of psych, and psych is energetic. So systole. And then diastole, imagine something that has died. It's die.
Just left.
Diastole. Of course, that's not what those words mean, but
that's a way to remember.
That's a way to remember them. So during contraction of the heart, during systole, the pressure that is recorded is put on the higher, the number that's on the above the line that they usually use. So there's a number above
40 now.
Yes. So the one that's above. So, and the normal blood pressure for systole is less than 120. Less than 120. That is normal blood pressure. Yes.
Now, when you talk about normal, is it normal in the sense that is expected of everyone, or?
Of course, there are extremes, like in the same way you have a normal distribution curve. Majority of the people should fit
the normal. Now,
the normal. However, we have people who are on the on the extremes, and especially on the lower side, and this affects, and this might be normal for them. And these are people who engage in
strenuous
activity or regular sporting events. A good example is marathon runners. It's very common to find a marathon runner's blood pressure on the lower end, and as well as his heart rate. And it's because of how the body adapts to that. Yeah, but to summarize, the systole, which is the number above, should be less than 120 for normal blood pressure, and the diastole, the number below, should be less than 80 for normal.
Okay.
So when they go above that, that's when now we get into the realm of abnormality. But the definition of hypertension is hit when it's up at 140 and at 90. Upper katikati, we have some room for what is called elevated blood pressure. So not necessarily.
So between 120 and 140, or 90 and 80 and 90, that is a range that can still.
Yeah, that is a range that can still be played with, but it's still elevated blood pressure.
So that's still not normal.
That is still not normal.
Should be below 120.
Should be below 180 and below 80. Yeah.
So, for example, high school children, high school boys.
Yes.
What is their pressure?
High school boys. So they tend to be a bit more active, but also remember they are growing.
Yeah.
So their heart rate might be higher, and that would put their blood pressure a bit higher
than 120.
Yeah, than 120.
So then,
but largely it should be less than 120. It will be a bit higher than the, let's say, the normal 190. But it should ideally still be less than 120. We don't want to go above 120.
And then when we are measuring this, we are assuming it's at the relaxed state.
Yes.
Somebody is not doing something strenuous.
Oh yes. So even when you want to measure blood pressure, there are certain regulations or protocols that have to be followed. Like now, what you're saying, someone has to come in where they're measuring. It should be somewhere where it's relaxed, no noise, nothing that could aggravate the person. And then they should sit down, ideally for 5 minutes or more, in a relaxed manner, where they are allowed to settle down.
Yeah.
And then the blood pressure is taken after that, after they have relaxed.
Yes.
And they shouldn't have taken things like coffee,
caffeine,
nicotine, nothing to cause the heart rate, to increase the heart rate or to mess with the readings. Yeah.
So that is also important. I think people need to hear that when you're measuring the blood pressure, you need to relax first. Otherwise, it will give you wrong readings and you may think there's an issue when actually it's just that just normal. Your body is training something. Your heart is pumping faster. Okay.
Or you're anxious.
That also increases the heart rate.
Yeah.
Okay. So for most of the people, you've said 120, 80.
Yes.
Now, when it gets to above 120 and 80,
yes,
what are the causes?
So now,
apart from just doing exercise or something strenuous, what is the reason?
The reason now maybe as we go there, let me clarify on that one, above 120. So now we say the normal is 120/80. Now when you go, certain bodies, medical bodies have classified the hypertension. So when you go from systole of above 120 up to 130, that is the region that is classified as elevated blood pressure.
So it's elevated.
That's elevated, And then when it goes above 130 all the way to 140, it's now getting to the realm of, hypertension proper, stage 1. That's what some bodies call.
So between 130 and 140.
140. And then down here on the diastole, between 80 to 90. When the systole is between 120 to 30, the diastole may maintain at 80, and that's okay. That will classify as being elevated blood pressure. But when the systole is between 130 to 140, the diastole would likely, for it to be classified as hypertension, would also likely go to 90 and above. So now when that happens, when you have elevated blood pressure, number one, as you said, it could be because of activity, strenuous activity that you're doing. But also
that would be also temporary.
That will be temporary because that goes back down.
So for this to be a condition, it has to be sustained. So it's something that will be, again, if you measure after some time, it will be the same.
It should be the same, and that's why you have to take care when you're measuring blood pressure for any individual. They should come in, they relax, so that you're not, getting a hypertension that is actually masking itself as hypertension, but it's not.
Other things are causing it.
Other things are causing it. The other temporary things. Okay. So let me tackle the question you asked about what causes the elevated blood pressure. So hypertension is classified into two main groups usually. So there is what they call primary hypertension, and then there is secondary hypertension. So secondary hypertension tells you almost gives you the sense, which is true, that it is coming secondary to something.
So there is being caused by something.
Yes, so there's a clear identifiable cause. This is what is causing hypertension, and they can pinpoint and say this is the problem. Whereas for primary hypertension, there isn't an exact identifiable cause, but what are there are risk factors. We can say that there are certain things that are predisposing you or putting you at a place to hypertension. And actually, primary hypertension, the one that only has risk factors, is the most common. Comes to about 90% of hypertension.
That's hereditary. So
it could, yes. So now, one of the risk factors, you could have things such as that you can't change, things like your genetics, family history, things that you can't change.
Body,
your age, you can't change
age
your
also,
age. Yes, but then you have things that you can change, like now your body. And this now talks about obesity and being overweight. Being overweight actually predisposes you
somebody for
hypertension. Okay. And then you have things such as intake, what you eat, like someone who takes a lot of salt. So salt,
sugar,
not sugar, salt. So salt has a problem with hypertension. If you take a lot of salt, there's a constituent of salt, namely sodium, that if you take too much of, it's going to elevate. It's going to elevate your blood pressure. Also something like diabetes, interestingly.
So another disease.
Yes, another disease can
cause blood pressure.
Can predispose you to blood pressure. Smoking as well. So stop smoking.
So smoking. Is it from the nicotine or what?
So nicotine, especially, it has a role in distraction. It affects blood vessels, not blood cells, blood vessels.
So inside.
So it tampers with blood vessels, and I think that's where the problem comes in with hypertension.
So it's with the pipes.
The pipes. You remember when we were talking about
something inside there.
Exactly. Exactly. Remember when we were talking about the blood pressure, either the pump or the pipe. So this one affects the pipe.
Okay. So let's begin with the primary ones.
Yes.
So there are people, if in your family somebody has hypertension, probably you're also predisposed to that.
Yes.
Okay. And then that means it had to begin somewhere. Is it what is it called? When genes, there's a malfunctioning of the genetics, and then that now is propagated in the family.
Yes, sadly, unfortunately, of course, as Christians, we know we live in a fallen world.
Okay.
There's the fall not only affected, it affected, of course, the whole world, but also our bodies. We die. Yeah. So there's a tendency to decay, there's a tendency of things to go out of place. So our genetics, there are certain illnesses that we are predisposed to
because of
certain genetics we have. And we have no control over that. It's something that you've just been born.
Yeah. Then you mentioned about age.
Yes.
So this means that there's a particular age where hypertension should be expected in people.
Yes.
What is this age?
So above 65 years of age. Yes. So when you go above 65 years of age, then the tendency, your blood vessels. Let me talk about it this way. So there's a wear and tear.
Yeah.
Yes, as you grow older, there's a wear and tear. And for the blood vessels, sometimes what this looks like is that there's a decrease in their elasticity. Yes. So imagine if a pipe is elastic, it means that it can
absorb the pressure.
It can absorb the pressure, and also it can hold a lot more blood. But if a pipe is not elastic, it's very stiff, then that predisposes it to having the pressure. Yeah.
Makes sense. So then above 65 for both men and women?
For both men and women. But it's interesting, before menopause, men are more likely to have high blood pressure. But after menopause,
women.
Yeah, but before menopause, women are less likely to have high blood pressure. Let me put it that way. And men are more likely.
And so this before is about 55 years.
This is about 55 years. Okay. Yes. But after menopause, it evens out so that now both genders have the same likelihood. But before menopause, women are less likely.
After?
Yes. After they even out.
Yes. Okay. Yeah. So is there?
It's interesting.
That's interesting because what is this that is in what changes at menopause that makes women more?
It's multifactorial, but I'm sure I'm not completely sure, but I know it has something to do with the hormones, because that's one of the big things that change after menopause.
Some female hormones are not being produced.
They stop being produced, and that might have an effect on the balance, the homeostasis, or rather how the body balances its systems out. Yeah, but I'm not exactly sure about what happens at menopause.
Very interesting. I think research maybe what that can give
that can give, exactly. That can give the impetus for someone to go and find out. Yeah. And I'm sure if I look it up, I should be able to find that information.
Good. So the age and then the genetics.
Yes.
Then you mentioned obesity. Also, sometimes is that also genetics? Are there people who are predisposed to obesity?
That's an interesting question to ask. Well, in your family, you might have that trend of people, being overweight and obese, but it's not much of a genetic issue as it is of a lifestyle or a what do you call it? Yes, a life. That's the best word. Lifestyle. What you're used to seeing, what you're used to doing in your family.
But are there fat people who are not obese? Because I remember when we were in primary school. There were always one or two children. We ate the same things. But they were obese. They were not obese. They were big. They had bigger bodies, and they were very much. Some of them were. I remember one of our classmates. He was the most active.
Yes,
but he was also
very big.
Yes.
Yeah, that's interesting. But obesity is a measurement of. And even, of course, it's height. Obesity is exactly. So that's what I'm going to height and weight. So you have the normal. You have people who are underweight. Then you have people who are within the normal, and then you have the overweight people, and then now you have the obese. Above that. So if you are too heavy, you are more heavy than you are tall. Then that will be
for your height. So there's a particular height. There's a particular weight expected for a particular
height.
If you go beyond that one,
then you're overweight. Yes. So tall people tend to be heavier, and that's expected.
Yes, because more mass.
More mass, yes. So, but then if you are very tall, but then you're also extremely big, then that will also tip your BMI in the wrong direction.
Okay. So then obese can cause blood pressure.
Yes.
And how
Can
what is the
predispose.
biology? Predispose.
Yes,
What is the
yeah.
biology behind that also?
So now, how I thought about it for a while, and the pathophysiology lies behind. Think about it this way: you have a pump that is supposed to send blood to supply the far reaches of this huge, system. And remember, even your fat cells, even the fat in your body, receives blood. It has blood, tiny blood vessels that get there. Because if that was not so, they would die, and that would rot. But they have blood supply. So, a heart has to pump blood very far to very, tiny places. So what it does, one of the things that the vessels adapt to this by doing is by increasing the pressure inside the vessels. And how you do this is either by increasing the contraction of the heart or reducing the aperture, reducing the diameter of the vessels. So if you have triggered the heart to pump hard as it can, but you're still having blood not reaching where it's supposed to reach, then the blood vessels will also constrict. The idea is the pressure to be high enough to get to where
it's trying to just increase the pressure, get the blood to where it needs to get to. And in the mean, as it's trying to solve that problem, it creates another problem. And that's where the blood pressure comes. Yeah, that makes sense. Yeah. Okay. And that part now, the eating part, because that's also the obesity. Maybe I found out opportunity to ask this question. I was told that if you pinch your stomach and it's more than 1 inch, you're overweight.
Oh yeah, there's actually a particular tool that you use. I forget what it's called, but it's like a caliper, tiny caliper. It pinches just in the right way your skin. The principle behind this is that it's measuring out your skin thickness. So, remember, there's adipose tissue that is deposited under your skin.
The skin.
Yes. So if it pinches a lot of adipose tissue within the skin, then that is a measurement of. So the people who say I pinch yourself, they're trying to mimic what that caliper does, that instrument does.
So does it work or?
Well, I mean, it can give you some gross measurement. You'll be like, hey,
you can look at that.
But most people, if you do this, you'll get some amount of.
Also, we had mentioned that there is fat under the skin and also there is fat around the organs.
Yes. So
that is more dangerous.
So the one around the organs is more dangerous. Not only because it's not seen. Yeah, I think that's the main reason. It's not seen, so you might not even know that you have, you have a lot of fat accumulation. The fat that accumulates on your skin can be visibly appreciated. You can do something about it. You can see it when it's coming, and you do something about it. But the one that accumulates in between your body organs, you have no way of telling.
So there are people who look slim, but actually they are very fat inside.
But the good thing is that as you have fat inside, as you say, your visceral fat is a lot, and it's clogging up the spaces between your organs. We can measure that. We can measure. You can measure the amount. It will show up somewhere, and that's in your blood. So we'll do what is called what are they called? Lipid tests. Lipid tests. So we measure the fat in your body.
So the amount of that in the blood is what will determine whether you're okay or not.
Yes, and even for the person who is visibly big, we still look at the lipids. And the lipids, there are several lipids, but there's a particular one that if it's dangerous. High, so you see this is a problem.
So people should actually do that test
regularly.
Not to assume that I'm thin. So
do not assume that you're thin.
Also, does it show the weight? Does it affect the weight?
Yes, it will affect the weight. But of course, since the space inside is not that big, it will not accumulate because there's muscle that limits. Okay. Yeah, so it might not accumulate to a significant degree for you to cause a big change in the weight, but it will accumulate to a significant degree to cause a problem in your blood. Fat or rather lipids in blood is a problem. Maybe we can talk about that as well. Yeah.
Good. So then, because it's a lifestyle thing, what is this lifestyle? What are these lifestyle issues that bring about or predispose people to
hypertension? So we've talked about obesity and overweight. Another thing is your diet. So salt,
you mentioned sulfur.
Yeah. So sodium.
Sodium. Yes.
So
the chemical component of salt is?
So it is sodium chloride. It's sodium chloride.
So the sodium part.
That's the problem.
That's what I was wondering. Do they separate and then
yes,
the chloride goes and then
yes. So in your body they dissociate. Yeah.
Yeah. That's the problem now.
Sodium.
Unless if they were together, still there will be a good molecule.
Yes, but also your body wouldn't be able to. Maybe I should put a caveat and say it this way: sodium in itself is not a problem. In fact, your body needs sodium. Yes, but when it's a lot,
more than
your body is more than enough, then sodium has a role in affecting the pipes. You know what you're talking about? So it increases the tension in the pipes. Yes.
So by affecting the pipes themselves.
Yes, by affecting the pipes themselves, sodium increases your blood pressure.
Okay.
So when sodium chloride, when the salt is dissolved in water and also in your body, when it's the small intestine, when it's time to absorb them, it's absorbed as an ion, or rather in the broken down form, sodium ion, and then the chloride ion is also absorbed separately.
Okay. And then when the body has more than it needs, now that goes into the blood vessels, causing them to
constrict. Yes, increases the tension
inside
the
body. Okay. Then now it adds to the tension and the hypertension.
Exactly.
Okay.
So
salt is a big issue.
Is a contributor.
So people should start early to limit how much salt they take.
Limit how much salt you take. Ideally, per day you should only take about 2.4 milligrams. 2.4 grams. So that's about a pinch of salt. Yeah.
So in all the food I eat,
all the food you eat. But this measurement is taken seriously in patients who have already been diagnosed with hypertension. But if you haven't been diagnosed yet, you just need to significantly reduce, so that you don't get to a point where we have to reduce it even more by force.
So it's good to start early.
It's good to start
reduce
early.
That salt.
Yes.